Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Seizures. Classification of the drugs used in seizures, that is classification of anti-epileptic drugs. So first, the drugs which there are some drugs which prolong the sodium channel inactivation. The drugs which prolong the sodium channel inactivation are phenytoin, carbamazepine, valproate, lamotrigine, topiramate, zonisamide, locasamide, rufinamide. So these are the drugs that those the drugs which prolong the sodium channel inactivation are phenytoin, carbamazepine, valproate, lamotrigine, topiramate, zonisamide, locasamide, and rufinamide. Okay. Then the drugs which will facilitate the GABA mediated chloride channels. The drugs which are facilitate GABA mediated chloride channel opening, these include barbiturates, benzodiazepines, vigabatrins, then valproate, gabapentins, pregabalin. These will facilitate the GABA mediated chloride channel opening. Then the drugs which cause inhibition of T type of calcium current is the drugs which cause inhibition of T type of calcium current are ethosuximide, trimethadione, valproate, lamotrigine will cause inhibition of T type of calcium channels.
thank you and thank you for watching.